Now welcome Dr. Bonakdar to the program. He's joining us from San Diego today. And Robert, great to see you. And thank you for that wonderful presentation.
Great to be here.
We have a lot of questions for you. The first is, should you take supplements if you don't know what you're supplementing?
That's an important question. I think it's always wise before you start any supplement to really go through those questions of, do I really need it? I think there's a lot of marketing and promotion, so it feels like everyone should be on it. But in many cases, and unless we vet it and we really need it, it can complicate our healthcare regimen. You can do much better with diet, exercise, stress management. At the same time, once you go through those questions and you think, okay, I need some support for my triglycerides or my mood, and I've talked to my healthcare provider, absolutely, they can be a great adjunct. But it does need to go through those steps to make sure we don't have the stockpiling of supplements.
So if you do take supplements and you take, the supplements that you'll get for, just general health, and then the supplements for your eyes, and the supplements for your nails and your hair, and the supplements that you might take for nerve growth, and supplements that you might take for cognition, let alone, maybe other things. What's the chance that you may be taking the same things redundantly?
Yeah, I think redundant is the key word. I see that all the time in patients who come in with bagfuls of various supplements, all well-meaning. At the same time, they may be having excessive amounts, and I'm most concerned about some of the fat-soluble vitamins like vitamin A. I've seen folks overdo it on vitamin D. So too much of a good thing can happen, and really it's based on, let's take one condition, one area we're going to focus on, whether it's eye health, mood health, improving the mood, and really see if we can get a benefit over 3 months or 6 months, and then move on as we have time to others. I think once you have multiple chronic conditions, it's really about trying to find ones that do multiple things at the same time, like magnesium. We know it can help with inflammation, it can help the heart, it can help mood. So you don't necessarily need one thing for every, or multiple things for every condition. There are some things that are what we call pluripotent. They can help across the board. And that's what I really look for when we're dealing with a complex situation like that.
So again, I think, I'm guilty of this, and I think many people are, that when you find something that helps you, you wonder if you just take a little bit more, if that's going to be more better.
Yeah, that happens a lot. And I think the body does have some, mechanisms to let us know when we overdo it. Things like with magnesium, our gut can go on fast forward and say that's too much magnesium. In other cases, it may be very subtle and we may not know it until we get a lab test that shows elevation. And so I think it's important to check in, not just initially, but every quarter or so with our healthcare provider, to make sure that the list, just like our medications, we might check liver functions for if we're on a cholesterol med. Same might be true for some of our supplements, to make sure we're not taking too much vitamin B12 or too much vitamin D. And I think those check-ins are very important for ongoing maintenance.
So there are many proponents out there. You can pretty much hear in this day and age where there's podcasts and information all over the internet, pretty much every perspective. But there's a common perspective coming from a lot of the clinicians out there that are positioning themselves as longevity experts. And what they say is, before you consider supplements, look at your diet and just make sure your diet isn't deficient. Then consider supplements. I wonder what you think of that.
I think that's a great step. I think there's no benefit to being deficient in some of the key nutrients that we talked about, like magnesium and D, and they work across the board. So I think while there are very, supplements that might be all the rage momentarily, there are some key, named vitamins that, the vitamin Ds and Bs that may not be as sexy. But really, when we are looking at long-term mental health, physical health, muscle health, sleep, those are the ones that we want to make sure those tanks are filled, not overfilled or excessive, but definitely not deficient. And I think that's where I start with most patients. Just let's make sure we're covering the bases before we get into the specialty supplements.
What I hear you saying is, check your diet first, make sure you have a adequate diet. What is an adequate diet to you?
Yeah, I think there's many definitions, and with more and more, especially diets, ketogenic diet, et cetera, it can get confusing. At the end of the day, I tell folks, start with, are you getting your minimum amounts of fruits and vegetables? The 5 a day, and again, 90% of Americans are not. That's a great place to start. Make sure you're getting enough fiber. Aim for 30 or plus grams of fiber. Are you watching the added sugars? Those areas, if you can work, just start there. Those are amazingly beneficial areas to start. And those are key components of a lot of the anti-inflammatory diets. Beyond that, you want to get enough omega-3s, whole grains, et cetera. But those also impact the things we already talked about, getting enough fiber. So that's an adequate diet. And that can fit into a lot of the specialty diets, whether we're vegan or following Mediterranean or some of the other ones. Those are the basics of any good diet before you go on to other supplement considerations.
So, Robert, with that said, a lot of people who are considering supplementing their diets also have medical conditions that may be treated with medications.
Mm-hmm.
Are there just can you just give us a quick overview, thumbnail of what medicines require supplementation of vitamins?
Yeah, I think some of the key ones that we're familiar with are some of the diabetes medication, like metformin, as an example, very powerful, important medication. But we know that can, across the board, help reduce or promote reduction in absorption of things like B12, magnesium, possibly iron. So that's really important because diabetics already have difficulty in some cases absorbing those. We also know some of the acid blockers are really important to consider because by definition, what they're doing is reducing acid, which is important to some degree to help with absorption of these nutrients and breakdown. That can also reduce B12, magnesium, et cetera. So we know some of the cholesterol medications can also deplete things like CoQ10 possibly, obviously chemotherapy agents. So I think what we need to do with our doctors and our healthcare providers is go through the medications, and these nutrient databases, depletion databases are free, and they give you a sense of maybe you should look at magnesium and B12, and then hopefully those can be tested to make sure. And in some cases, they're not going to be deficient because the diet has made up the difference. But if they are, then that's a good scenario for adding, let's say, a small amount of B12 to get that tank filled, so you're not having complications like nerve pain, et cetera, that can come from depletion that may be induced by the medication. So you can find a happy medium with the right medication and the right supplement.
So what would be the harm of oversupplementing for some of these?
Sure. That's a good question. So some of these vitamins that we know have a lot of benefit. We know, for example, some of the B vitamins are very beneficial for reducing inflammation, improving mood. But for example, vitamin B6 in excess can cause nerve pain. So some people take a B complex or high level B complex, like a B100. They may not need that. They might just need a multivitamin with Bs in it. And we often see the B6 elevated. It can be connected to nerve tingling, burning in the hands and feet, which unbeknownst to them could be coming from the supplement. We know vitamin D in some cases, people take that for bone health, reducing deficiency. But when that reaches high levels, usually over 100 nanograms per milliliter, that can also have some issues if affecting our hormonal system. That's important to keep in mind. A number of other supplements, especially if they're multiple, can be a lot for the liver to process. So that might not be something selected to that supplement, but if you're taking excess amounts that your body doesn't need, it's just more work for your body to have to process. Most of that's done through the liver, and that can cause liver function elevation. So again, important to keep that in mind and try to minimize the supplements to what's really essential for your individual health needs.
So Robert, then we think about, maybe some of the other substances that people may be using, like alcohol or cannabis. Do they change our profile in terms of needs for supplementation?
The cannabis is not as well documented, but we have tremendous decades of information regarding alcohol. We know it affects a lot of the B vitamins. We know there's actually, Wernicke-Korsakoff syndrome and actual medical issues that come from like thiamine, which is a B vitamin, being depleted because of too much alcohol. We also know that can cause issues with general absorption because of its effect on our gut and its ability to absorb all nutrients. So we know substances to the level of addiction can also just change our daily habits, our motivation, our mood, our ability to eat normally, properly, get enough activity. So obviously there's no supplements that's going to make up for that. So that's an important thing to come to terms with. And obviously nutrient repletion is one aspect of that, but primarily trying to just deal with the addiction potential and what it's doing for our overall lifestyle. Part of that is obviously poor nutrition.
So there have been a few questions about magnesium specifically. In what form? How much should you take? Do women need more than men? What time of day should you take it? How does it affect the GI tract in certain forms versus others?
Right, that's a great question. Probably one of the most common questions I get when talking about nutrients. So magnesium, we know, women, it's more of a weight based, so on average, slightly less, but somewhere in the 400 milligram category per day. We know that about half to probably 2/3 of Americans do not get that amount per day because the diet is depleted. If it's refined, it's not going to have those enough magnesium in it. That being said, if we are going to supplement, the problem becomes, well, I've tried it and it's caused my gut to be really unhappy. And that's because magnesium promotes the motion of our gut, and that's the milk of magnesia effect. So when people are constipated, magnesium in some of its salt forms like citrate, oxide, sulfate are promoting. So if that's an issue for you, those are fine to use because it's going to help the gut move and go to normal regularity while also giving us enough magnesium. That being said, most other people should probably look for a chelated, buffered type of magnesium, like magnesium glycinate. Also has some relaxing effects because of the glycine. That's a good bedtime option. Another two types are taurate and magnesium malate. Those tend to be better on the stomach while giving you enough magnesium. So that also needs to be individualized, and healthcare providers can sometimes help guide you with the right amount. Usually start 200 milligrams and move up so you're not eating too much all at once, and your gut will thank you for that.
So I think we're gonna end with a final question, which we probably could have you on for a couple hours, but we've got about maybe a minute and a half. And that is supplementation for sleep. Sleep is, insomnia is kind of an epidemic in our country. And I know that many people use supplements to help with sleep. So I wonder if you could just speak to that and what we know and where people should look.
Absolutely. It's probably one of the top categories because sleep, we know, is an issue for most Americans for various reasons. So I start with magnesium, which we spent time already talking about, but because we know magnesium has a relaxing component, not excessive, you can use it during the day, but some people use various types of magnesium, again, 200, 250 milligrams to start with, can have a relaxing effect. If you're using the right form, chelate, like glycinate, that can also have relaxing. So I would start there because you're treating a likely deficiency in 2/3 of us, as well as helping to promote sleep. It also can help promote mood and muscle relaxation, which over the next day can also help with our future sleep and just general well-being. Melatonin gets a lot of press. I do think as we age, we do know that melatonin does get depleted. Certain conditions like with pain, migraine tend to have depleted melatonin. So I do try melatonin sometimes at low dose, 1 milligram to 3 milligrams. Some people do better with higher, but I start low because it can cause vivid dreams. It can cause some daytime drowsiness. So you want to start low, use the minimum amount, but in some cases it can really be helpful for sleep onset. Then there's a slew of herbals, your valerians, your ashwagandhas, et cetera, that are relaxing, are touted as relaxing. Those are worth trying. Again, those need to be vetted through your databases and your healthcare providers to make sure they mesh with your other medications. But those can be helpful in certain types of stress-induced sleep difficulty to help relax the mind and body. But those, again, I would vet, but I would start with magnesium and see how you go and go from there.
Robert, I wish we had another 6 hours to talk with you. I can't thank you enough for your time, and on behalf of the audience, I think we're grateful to have you as part of this Wellness Academy, and we're going to have you back. Have a great weekend.
Thank you so much, Scott. My pleasure being here, and good luck with all your work with the Academy. It's really important work, and we need more of it. So thank you for all you do and what your team does as well. Take care.